Welcome to NCLEX Map, where we make nursing math clear and simple. Today, let's tackle how to calculate a drip factor, step by step. Every IV flow rate problem has three key parts. First, the volume to be infused in milliliters. Second, the time, which we always convert to minutes. And third, the drop factor, noted as GTT per ml. Here's the formula. Volume times drop factor divided by time equals GTT per minute. That's how many drops per minute you set on your IV tubing. Let's look at a basic infusion example. Infuse 1,000 milliliters of normal saline over 8 hours with a drop factor of 15. Convert 8 hours to minutes. 8 times 60 equals 480 minutes. Now calculate 1,000 times 15 divided by 480 equals 31 GTT per minute. That's your flow rate. Now let's do a pediatric case. A child needs 250 milliliters of D5W over 2 hours with a microdrip of 60. Convert 2 hours to minutes. That's 120 minutes. Now calculate 250 times 60 divided by 120 equals 125 drops per minute. This means 125 milliliters per hour with microdrip tubing. Next, a critical care adjustment. 500 milliliters of antibiotic over 3 hours, drop factor 20. Convert 3 hours to minutes. That's 180 minutes. Now calculate 500 times 20 divided by 180 equals 56 drops per minute. Let's look at a rate per hour example. 75 ml per hour with a drop factor of 15. 75 divided by 60 equals 1.25 milliliters per minute. Now multiply. 1.25 times 15 equals 19 drops per minute. Finally, let's add one more example with volume in liters. The order is 1 liter of lactated ringers over 6 hours with a drop factor of 20. Remember, 1 liter equals 1,000 milliliters. Convert 6 hours to minutes. 6 times 60 equals 360 minutes. Now plug it in. 1,000 times 20 divided by 360 equals 55.5, rounded to 56 drops per minute. That's your infusion rate. A few clinical pearls. Always convert liters to milliliters and hours to minutes before calculating. Round to the nearest whole number for accuracy. Use microdrip sets for precision and macrodrip sets for larger volumes. And always double-check your manual calculations with the IV pump when you can. Understanding the relationship between volume, time, and drop factor helps you solve any IV calculation quickly and safely. No guesswork, no stress. If you found this helpful, like, share, and subscribe to NCLEX Map, where nursing clarity meets clinical confidence.